So HCA Physician Services, we mentioned earlier, so important. You know, you guys run hospitals, so you know how important it is for hospitals to have a partnership with their medical staffs. And you know, we're really focused in HCA of being a world-class physician organization. In many of our markets, not in all, but in many of our markets, there's been a movement towards employment over the last 2 or 3 years. And currently in HCA, we have roughly 2,000 employed physicians across our markets. And we've really kind of focused on making sure we have an infrastructure to be able to manage that size organization in terms of billing and collecting, in terms of practice management systems. We are an ECW shop, or eClinicalWorks, and we've rolled that out company-wide. The back office, the EMRs will be out to all of our employed physicians, so they'll all have an electronic medical record for their practice by the end of next year. We also, in addition to employing, and one of the ways we work with our local hospitals is through recruiting. So we also recruit almost 1,000 physicians a year into our local communities when there's a community need and when there's an independent group of physicians in that local community that wants to grow. We work with them to accomplish that. The other thing HCA does that I think is impressive is we really provide strong tools to our local management teams to assess community need and to determine and work with their local medical staff on contracting resources. We have a very significant legal and compliance department to make sure that when we do recruiting employment, that we do it correctly and we follow the rules and make sure that everyone stays out of trouble. This all evolves from local markets, though. I mean, the key here on a planning standpoint is it's the local management team working with that medical staff to determine what medical staff development plan is needed. And really, HCA Physician Services then comes alongside that local management team and helps execute that plan once the plan is developed. And that involves really through both recruiting and employment. We wanted to show you some of the trends. We're definitely seeing a growth. This is employed provider headcount. So you can see from 2007 to 2010, HCA has doubled roughly the number of employed physicians across the many markets that we serve. And we're up to 2,400. The 2,400, as you can see, includes not only what you would think of as private practicing physicians, primary care and specialists, but it also includes hospital-based physicians. We're a large employer of hospitalists, and we employ in certain markets our ED physician group or our anesthesia group. So we're seeing those trends continue as well, and making sure that we're set up to accomplish that.
But I think it's key, an important point that maybe Dan, the infrastructure that we have around physician recruitment, each of the divisions have their own recruiters working with the division and the hospitals in that division to meet the needs of the community in terms of physician recruitment. So in the West Florida division, how many folks do you have assigned to recruitment?
We have about 5.
We spend a lot of time at the various medical schools, not just here in the state of Florida, but throughout the United States. Obviously, we participate in a number of training programs. Here in the state, we have one of the last large internal medicine programs that were approved, and that's at JFK, and I think we have like 50 to 60 slots that co-participate with Veterans Administration as well as University of Miami and FAU. We have the largest osteopathic training program in the country.
Yeah, or in the Southeast for sure.
Over in Tampa. Very proud of that. In fact, this year you'll have, what, 110, 120 residents?
Yeah, 110.
110 residents in that training program. So using our teams on recruitment as well as using these same resources to participate with the training programs to continue to provide physicians into the community, working with our local physicians for those that want physicians to join their practices and or where it makes sense for us to employ.
Yeah. So these are the trends on recruiting, physician recruitment. You can see we've moved in 2007 to just short of 900 to just short of 1,100 projected our year-to-date through 2010. The other thing that, as Chuck mentioned, that we're very engaged with the medical schools and the residency programs. You can see that we have a really active stipend program to help medical students in their residency with a stipend, and then when they come out, they come to work for HCA in one of our many markets. So that's been a very good program as well.
Serving the community, very proud of the many things we've done, not just throughout the state of Florida, but throughout the country in terms of serving our communities. Habitat for Humanity has been a key, marquee program that we've been involved in with many years. as you can see from the statistics there, have contributed over $3.2 million. 10,000 of our employees participated, 80,000 volunteer hours. The Hope Fund. The Hope Fund is specific to HCA and HCA employees, and really came out of Katrina and the many financial issues our employees had post-Katrina and disruption, obviously, on lives that hurricane had. So the company created the HCA Hope Fund, and we take donations from our leaders, our employees, go into the Hope Fund, and then we use those monies to assist our employees who have, for one reason or another, have particularly difficult times that they're going through with their personal lives. Scholarships. We also have an internal scholarship program. You can see from the slide that over 5,000 of our employees have received scholarships through this fund. Step Up for Students. I'm sure that many of you in the room are very familiar with Step Up for Students here in the state of Florida. We've taken a lead position in terms of participating in Step Up for Students. As you can see from the stat, over 55 million plus contributed to Step Up for Students, which these are tax credit scholarships provided to those that can't afford access to that education, as well as all of our hospitals participate in various charities and initiatives, be it American Cancer Society. I saw an email from Dan this past week, American Heart Association, et cetera, as you do in terms of supporting the communities. These are some stats specific to Florida in terms of what we do here in the state of Florida. Roughly about 3.5 million patients treated, significant Medicaid share, significant uninsured share. We're a big employer here in the state. Almost 42,000 employees here in the state work for HCA. Big population of volunteers supporting our many hospitals and providing service to our organizations, a little less than 7,000. And obviously a big physician community as part of our facilities as well, a little less than 11,000. The economic impact, Mike, I'll let you speak to some of the economic impact throughout the state.
Sure. So, we're one of the largest employers in the state of Florida, $2.5 million in annual salaries.
2.5 billion.
Billion, thank you. Big numbers. Cost of charity, we've already mentioned $500 million a year. So this is cost, not charges, and it's unreimbursed. So, this is charity, bad debt, and the uninsured discount programs that we've mentioned. So, as I've already stated, we're a pretty significant part of the safety net in the state of Florida, and we're proud of that work. We pay taxes, so we're a proprietary health system, about $306 million a year into the state of Florida. When we acquire a hospital this size, generally we generate $2 to $3 million a year in property tax back to their local community. So, that's one of the avenues we bring as well. As Chuck already mentioned in the previous slide, we spend a lot of money on capital investments back in our facilities. It's the main way that we get growth as an organization, is organically by investing back into our community. That
we provide in each of our division structures. And recall that we have 4 divisions, not just one division within the state of Florida, with the similar infrastructure that Dan and his team have to support the hospitals and the needs of the facilities. Which also includes managed care and the use of our managed care teams here in the state, working with the major payers. And go back to the supply to the billing collection process. One of the great values of that is, yes, we reduce our days in R, et cetera, but in terms of remediation of claims, understanding when there's denials, understanding the reasons there's denials, and better able to negotiate contracts, working with very good data when we're working with our payers for our contracts.
On the emergency department, it's the front door of every hospital these days. The majority of our admissions come through the emergency department. It's a big part of what we do. It's a big part of what every hospital does. As Chuck mentioned earlier, we have a very significant structure around our process improvement agenda in our emergency departments. Our goal is to make sure we can see the patients as quickly as possible, that we get them dispositioned and discharged, either admitted up to the floor or out as quickly as possible, and provide great service. You can see some of the statistics here. The Eastern group, this is West Florida Division statistics here, but for the Eastern group last month, our average was 21 minutes from when the patient arrived until they saw a physician. So we've made significant strides in this area. It's another area for transparency. We put our average wait times on our websites and on billboards so that the public knows. we believe in transparency.
But again, the
related to that.
resources of process improvement are built within the division. It's not a top-down approach. It's working with our local hospitals through the division offices in terms of the execution of these processes. You know, and again, on conclusion, HCA strategy, a couple slides here. One, you know, not sure exactly, you know, where the board may be going in terms of their partnership and the structures they're looking for. But when we get involved with a hospital, each hospital has their own local board comprised of, frankly, the recommendations of the leadership team. They're on the ground. We don't come in and make our recommendations. We work with management in terms of who's going to participate on the hospital board. Our role is to provide day-to-day management operations, and then, of course, like all organizations, have the oversight of the board and the medical staff providing guidance to the administrative team. We went through all the various infrastructures that we would provide to the organization, from supply chain through our large centralized billing and collections. All aspects of that would become integrated into the organization as we move forward. Very proud over the years of in transactions that we've been able to do to create significant foundations across the United States as well as here in Florida. Health One in Denver, when that transaction was completed, provided over $900 million of benefit back to the community through a foundation, which I know you have a foundation. Methodist Healthcare is another example where they created a significant foundation, $236 million. Health Midwest actually created two foundations, a total of $500 million that were contributed into those not-for-profit foundations for providing services on a continued basis in the community. Here in Jacksonville, with Brooks, when we bought Memorial Jacksonville, another foundation. JFK Medical Center, yet another foundation. And it's not on here, but when we acquired Cedars Medical Center in downtown Miami, a large foundation was created as a part of that. Hopefully today we gave you at least a snapshot of who we are. Our agenda, particularly around quality, obviously you can see it's a critical agenda for the company. We don't think, and I'm sure you as well, we won't be successful unless we can provide results around the quality agenda. And the quality agenda is first and foremost in all of our minds. In fact, I will tell you that I sit on one of the board's safety and clinical committees, and in each board meeting, we go through in significant detail, as I'm sure you do, all the processes and structures around our quality agenda, and report back to the board how well we're doing in that front. Efficiency, yes, efficiency is very important, particularly in this environment. I think I caught the news this morning where in September, the state of Florida had another uptick across the state in unemployment. This environment that we're in, as it has been in Richard, over the last many years in this environment. It's a very difficult management environment, and bringing efficiency to the structure is going to be hugely important for all of us if we're to be successful in providing the top quality care that we want to provide in our institutions. Yeah, we are a business partner. We think that we provide access to capital, access to information, access to IT infrastructures, which becomes a critical aspect of your operations on a go-forward basis. Probably more so today than any other time, particularly with the electronic health initiatives that are being rolled out across the country. And we feel very good about our position in the communities that we're in. We've been here a long time in Florida. It's easy to check us out in terms of the markets we're in and what we're doing, and some of the charities that I mentioned here on the slides. But we're very proud, and we think we're a critical piece of the healthcare delivery system here in the state, and that we're doing our fair share around the providing of Medicaid and indigent care in the communities, as well as providing access in our emergency rooms throughout the many geographies that we're in. With that, I'll turn it back over, Richard, to you in your chair, and for any questions that you may have.
Okay, thank you so much.